All right. Hello. Thank you, everyone who is joining us. We have a couple announcements as everyone is logging in. First, we are recording this session and it will be available here in Excel Events for the next 30 days and then on the Alliance's YouTube channel after that. Second, if you'd like to ask a question during the session, please make sure to use the Q&A area to the right of the viewing window. If you would like to access English or Spanish captions or Spanish audio translation, please use the widget below this viewing screen or use the link that I just put into the chat to access them in a separate browser window. Finally, this is a webinar style breakout session. Speakers will not be able to see you, but they will be able to see your chat and your Q&A comments in the panel on the right. So please feel free to use that throughout the session. Ready to get started, so I'm going to hand it off to our speakers to begin. Thank you. Go ahead, Esther.
Hello, everyone. Welcome to our session titled Building Rural Food Security Through Community and Food Partnerships. I am Esther Liu, Advisor for Food Security Projects, and I'll be joined by my colleague Jillian Papa, Advisor for Program Monitoring and Evaluation, and we represent Save the Children. So we are happy to share with you today 3 food delivery models that have been innovative in bringing food to rural communities. And within these models, we'll share how school and community partnerships are built on trust, which has led these models to successful food delivery. We'll share evidence of how these trusted partnerships are crucial in meeting needs of vulnerable communities, including one model that suggests improvements in food security. And then, because we know those in the audience here a lot of you are practitioners and implementers, we'll close with lessons that we learned that we hope will be useful for you as you engage in similar food security strategies. So let's begin by looking at why food security is important to Save the Children. The issue is that children who live in poverty are more likely to start school at a significantly behind their peers and never catch up. And we know that this issue is multifaceted. It is complex. But the solution that Save the Children offers is that we invest in improving opportunities for improving early learning childhood development and also grade level proficiency in math and reading for children. Because we know that if access to food for families is improved, then that also improves the likelihood that their early learning outcomes will improve as well. So in rural areas, children and family may live in isolated and outlying locations where access to food is limited. They make hard choices between competing priorities, like do they go get groceries with the limited funds they have? Do they put gas in their car, pay for rent or their mortgage? Do they stay at a job? And there are compounding factors like geographic isolation, limited grocery options where they usually get their groceries at the dollar store in town because the next one is in the next county or 15 miles away. And if they do access charitable food assistance, they face stigma, which heightens their vulnerability. So this means that while traditional food programs exist, they often miss families that are most in need due to these number of access barriers. So Save the Children has been fortunate to have collaborated with wonderful organizations that all have been interested in building food delivery models that leverage the strengths of local partnerships. When families are unable to travel safely to where the food is due to illness or disability, or they have caregiving responsibilities, then these mobile delivery methods have connected them to the food where they are. You'll see that across these 3 models, we'll show you how schools, nonprofits, and local institutions have served as trusted intermediaries to communities by tailoring the delivery solution to each rural context. So, first in Kentucky, um, we supported a high volume rural home delivery model that home delivered perishable and non perishable foods in meal boxes weekly for about 15 months in 2023 to 2024. And then in West Virginia, we supported a program called the Extra Mile that was a hyper-local grocery home delivery program that included fresh, frozen, and shelf-stable food in food boxes. And these were delivered 1 to 2 times per month to families in the span of a year. And this program is still ongoing. And lastly, we do continue to support multi-purpose mobile units that deliver both food and early learning programs. And the food comes in the form of shelf-stable or perishable groceries, hot meals through a food truck, or food gifts in kind, which is donated foods from our corporate partners. And the frequency at which it operates varies depending on the needs of the community. Units bring food out to the community multiple times a week, some monthly at, let's say, a community event. So these mobile units have been operated by partners since 2021, and they continue to go out on the roads to serve families. So let's take a more in-depth look at each of these models, and we'll start with the rural home delivery project, which occurred in Southeast Kentucky. This project served 2 counties, Harlan and Bell counties, that are very spread out with some homes in secluded hills and valleys. So this geography was considered when bringing together this combination of cross-sector partners. And together, their expertise and community assets led this rural home delivery model to a high volume success, delivering 1 million meals across the span of about 15 months. So there are 5 main partners here. In addition to Save the Children, we had high involvement from all of them: the school districts, a regional food bank, a local food pantry, and Amazon, who was the funder. And so I'll go through quickly the role of each partner in this project. So family liaisons from the school districts know the community and the families very well. And they identified families by seeing who qualified for other needs-based programming that the school might be offering, and they enrolled these families. On the operation side, a regional food bank sourced the food and put the food boxes together. And then they distributed them to a local pantry that hired individuals from the community to deliver the food boxes. About 60 to 90 deliveries went out to homes via refrigerated trucks each delivery day, which was always ahead of the weekend. Another unique thing about this pantry is that they also had a customer service system where families could report delivery issues, which helped them to resolve the issues very quickly. Now, on the administrative side, Save the Children supported with project management and an evaluation, while Amazon funded the program and was also very hands-on in contributing their expertise in logistics. So they utilized their software to help map difficult to find addresses in these hills and valleys, and also contributed their warehouse optimization expertise. They visited the pantry and demoed to the pantry staff how to optimize storage space. And finally, all partners had a bi-weekly sync call throughout the length of this project where they could share updates and also provided space for them to problem solve together. Now, in this second model, named Extra Mile, the Mountaineer Food Bank in West Virginia was the overall facilitator of the program. They designed and implemented the program, procured the food, and also had held an existing relationship with the school district. The school district, like the previous model, was very highly engaged in both the planning and implementation of Extra Mile. So similarly, school staff like community and school coordinators and those that work with families experiencing homelessness were the ones who identified and enrolled the families. And the district also recruited volunteers to assemble boxes on delivery days at their auxiliary gym. Then for the most unique feature, they hired their own school bus drivers to home deliver the food boxes in their own vehicles. So school bus drivers are trusted by families, and they're also very familiar with the local terrain. So they could navigate around poor cell service and unmarked rural roads. They'd also sometimes call the families the day before to make sure that someone would be home to receive the food boxes. These bus drivers would pick up the children from home, bring them to school in the morning, run their extra mile routes during the day, and be back in time at school to pick up kids from school and bring them back home. So these food boxes were very much so designed with care. They sourced items with seasonality and geography in mind. They included both local and culturally appropriate staples. And each box was very consistent. It typically contained grains, dairy, protein, vegetable, and fruit. Now, on the food bank side, on their intake forms, they added a question where families could indicate if they needed cookware or appliances to prepare foods, because much of it was fresh. That was important to the families. So the food bank then coordinated with other community organizations that provided the appliances, such as an air fryer, so that the families were able to prepare the food. Now I'll talk about our last model. So this model comes in the form of vans, RVs, food trucks, and mini buses, like you see here on the right on the slide, that have been converted into multi-purpose vehicles to provide co-located programs. And they are arranged. So there are parent-child groups that have happened on the mobiles. Community organizations have set up shop outside the units to do SNAP and WIC enrollment. They've referred individuals to GED and ESL classes, done food distributions, kindergarten registration, and also provided as a mobile hotspot, which is especially important in rural areas where broadband is limited. All these units are owned by local partners, and in 2023, 61% of them were owned by school districts. In current day, there are 19 mobile units running. So Save the Children provides the funding and technical assistance and training to the partners, but really it is the partners that make their programming decision for what sort of services and programs they want their units to bring into the community. And the types of services are determined by local needs and also by a cross-sector committee made up of the school districts, community-based organizations, faith-based organizations, and food pantries in the areas. And these are just some of the partners, and the partner that owns the mobile unit seeks to engage many more, depending on where they are. They're driven and staffed by familiar faces that consistently show up at mobile unit events or just show up around the neighborhoods. So when kids see the colorful bus, they know what's coming is joy and care alongside family-friendly programming. Now, these units have traversed diverse geographies around their county, whether it is over the mountains, through the valleys, across deserts. They reach different types of families according to their needs. So there's one unit that runs in New Mexico that does food distributions in the early evening times because they know that that's a time that working families are able to make. There's another unit that does a home visiting program for families with kids 0 to 5 years old. So in providing a different type of program at different times for different families, they're able to reach the families with the services that they need and want. So mobile units show how valuable it is for both partners and families to feel personally connected to each other. In rural communities, they represent much more than a food source. They're a safe space for caregivers and their kids to have a hot meal together. So I'll end my session here by sharing some words from implementers of these programs that have bridged the transportation gap for families. The first quote here says, "Everyone on the team comes from a place of, yes, we don't really know what the challenges they're going to bring or what's going to happen with the program. And if something comes up, everyone comes from a place of wanting to figure it out and resolve it." Another quote, one quote from a mobile unit implementer said, the school district gets the addresses, or they get the places where we can find the children and the families. Everybody's working together. That is what's helping the mobile unit really reach the people that need it, to their houses or even to the places in the desert. If it is safe, we go there. And the third quote, because of the frequency in the community, people are starting to see us, and they know our names, our faces, and the work that we are trying to do. So I think that the consistency over time has helped to develop a sense of trust from individuals who come in contact with us. I think the partners really sum it up well in terms of the impact that these types of programs make on not only bringing an improved quality of life to the individuals, but also the sense of connection that these families have to food. So now I'm going to pass it along to my colleague, Jillian.
Great, thanks, Esther. Thanks for highlighting these models. So I'll take it from here. I wanted to start with, being able to talk about these partnerships and potentially their impact. So these examples really have shown how trusted relationships and local collaboration make food access possible, and especially where traditional systems may fall short. So I figured I could spend a few moments highlighting one of the models, the Extra Mile Home Delivery Program in West Virginia. And this program has shown how strong trust-based partnerships don't just improve access, but can also lead to improvements in well-being. So in other words, when the partnerships are strong, the outcomes can follow. Okay, and then I'll talk about the evaluation of this project. So in 2024, we conducted an evaluation to understand who the program reached and how participation may have affected families' food security. We collected data across 3 survey waves: baseline, midpoint, and end of grant, using text and email surveys. And then we did some interviews if folks were unreachable by those methods. And these were all completed by caregivers enrolled in the program. Across the waves, we had an average response rate of about 75% and a total of 81 matched respondents included in the analysis. And our evaluation focused on 3 areas: household demographics, food security status, using the USDA 6-item validated scale, and participants' descriptions of how the program supported them. Next slide. Okay. And so what we found was that the evaluation showed that the program reached families most vulnerable to food insecurity. So we found that 57% of respondents were food insecure at baseline, about 4 times the national rate. We also found that hunger was not static, which is something I think a lot of us know. And across the survey waves in 2024, 72% experienced food security at some point. So this really underscored how dynamic and reoccurring food insecurity can be. The program reached households historically shown to face higher risk for food insecurity, so single-parent households, families including someone with a disability, households with grandchildren or foster children. And all of these rates were far above national figures, confirming that the program successfully reached families with significant and layered vulnerabilities. Next slide. In addition to understanding who was reached by the program, evidence suggests that we did find that food security declined by about 10% across the grant period. Although non-significant, we found that direction of change to be meaningful and wanted to share that, especially given the economic context in the following bullet, where families reported a gap between what families could afford and what they needed to be food secure. And this decreased over the year as well. And even as household incomes declined during the same period. So this really suggests that economic conditions worsened for families, yet food insecurity metrics improved. And so this is a pattern that suggests the program potentially mitigated the negative financial impact on families' food access, and really shows that trust-based, locally led delivery systems can potentially support improvements in family outcomes. Next slide. And so across all the models, I spoke about the Extra Mile program specifically, and now going back to all the models, participants and implementers shared feedback through a variety of methods, whether it was surveys or interviews, reports, focus groups, and the following themes emerged for us. We found that families reported improved food access because they receive food directly at home or in neighborhood hubs. And this was especially vital on weekends and during school breaks. We found reduced stress. Families reported less worry knowing food support was reliable. Easier access, so delivery and community-based models reduced transportation and stigma barriers. Economic relief, families saved money and could redirect those resources to other needs. And lastly, support for family routines, so access to regular food deliveries and distributions, simplified meal planning and preparation. And so I pulled a few contextual quotes from caregivers participating in the 3 programs. And really, caregivers describe how these models reduce stress, overcome transportation barriers, and provide reliable access to healthy food in communities where options are limited. And you can see that they really emphasize trusted, convenient, and consistent support makes a meaningful difference in their daily lives. So that first quote there says, "The constant assurance that there will be fresh, healthy foods for kids for the week takes a lot of pressure off our single income household." With regard to the mobile unit specifically, they talk about how mobile unit comes to you. It's great, especially where we live, where stuff is far. There's just nothing around here. And it's rare for something like this to come into the community, and they don't know what they would do without it. The food box delivery program helps my family by providing healthy meals and milk. Being delivered to the door is even more helpful because my vehicle isn't properly working. Next slide. So now that we've looked at some of the NPAC, really this brings us to the heart of the presentation, which is where we wanted to share our lessons about building and sustaining this kind of partnerships that drove those results that you saw. So first, leveraging trusted messengers. So across all 3 models, trusted community figures like faith organizations, school staff, bus drivers were really pivotal. Their relationships meant families already knew and respected them, which is most important in rural places. Consistency mattered. Seeing the same faces each week at school, home, or events really signaled reliability and care. Secondly, combining services to maximize impact. We learned we could maximize impact when food access was linked to other supports, so education, referrals, benefit enrollment. So mobile units, for example, distributed meals alongside learning materials, helping families connect to public programs as well. This integrated approach made food access feel like part of everyday community life and not just a separate or stigmatized activity. Third, designing for dignity and flexibility. And families emphasized that how services are delivered mattered just as much as what was delivered. So programs that allowed privacy, respected dietary needs, and offered flexible delivery options really built trust. And these small design choices signaled respect, and in that really in turn strengthened engagement. And then lastly, investing in collaboration infrastructure. So we learned in order to have strong coordination, you need clear roles, data systems, and stable funding. Dedicated local staff and volunteers really kept these efforts running, even in difficult conditions. And where partners had time and resources to plan ahead, they were more effective and sustainable. Next slide. So, of course, understanding those lessons is one part, but applying them locally is where things happen. So, really turning some of the partnership principles into local action. So, mapping trusted networks is a great first step. You know, who has relationships with families, schools, bus drivers, nonprofit, faith groups within your community. In our projects, trust was the entry point. When partners like school districts were engaged early, they helped shape outreach and kept communication open throughout implementation. And then aligning and co-designing with partners. So successful partnerships in our cases were cross-sector and intentionally designed together. And we see that as a way to apply this work. That means clear roles, shared timelines, and layering food access when applicable to existing supports like education. And then by co-designing this, it can really ensure programs fit like community rhythms and priorities instead of adding new burdens. Also, starting small, learning and scaling as you go. Each of our models began with a pilot, testing logistics, refining delivery, gathering feedback. Starting small allows for flexibility to troubleshoot before expanding, which is especially critical in rural or resource limited settings. And lastly, building for sustainability. Lasting impact depends on infrastructure. So coordination, data, staff, and of course, stable funding. Strong systems make partnerships resilient through turnover, funding shifts, or new community needs. And investing in that keeps the trust and collaboration over time. Next slide. So we have put out a few reports on the projects that you saw today. The rural home delivery program that was in Kentucky, you can find that on our website. The link is there. Mobile units, we also have a white paper report that we've put out. This is also on the Save the Children Resource Center website. And then additionally, we're working on a peer-reviewed journal submission in progress for the Extra Mile program that I shared a few moments ago. And I'd like to acknowledge Dr. Craig Gunderson from Baylor University for his support on the Extra Mile program specifically. Next slide, and I think that's our last slide. Well, thank you for sharing your time with us today. So maybe we can look and see if any questions have come in. Feel free to put that. There's a Q&A box on the far right. And we can also see the chat as well in case you want to drop something in there.
Looks like no questions yet.
Yeah, I'm looking too. All right. Well, we did share our emails on the previous slide. If any questions do come up, feel free to reach out to us. We can also put, I'm wondering, oh, we have a question. The question asks, have either of us been able to see these programs in person? Did anything stand out to you about these partnerships? Yeah, I was able to see at least some version of all three. What about you, Esther?
I was able to see the Extra Mile program, and also just 2 days ago was able to ride along on one of the mobile units in California.
Yeah. You want to tell us anything about that? Anything that stood out about the partnership for that?
Yeah, I'll talk about the mobile unit in California. So the mobile unit is named Lucy, and it operates in a very rural farming community called, in both two communities actually, Alpa and Sunnyside. And so I rode alongside the driver, who is a local coalition lead, who brought food bags to 3 different families that lived in the same neighborhood. And so she used that opportunity not only to bring food to families that needed it, but also to remind them of a parenting workshop that she was implementing that following week um, at the playground in the neighborhood. And so these are families that she sees very often. They're also families that she grew up with. So this lead, who also drove the mobile, grew up in the community. So I saw how it was important to have her build upon existing trust on her relationship with the families, to say that, hey, I'm coming to your house. Can I drop off this food bag? Or remember to bring your kiddo next week for this parenting workshop.
Yeah, that's awesome. And I'll just add, for one of the programs, the one that we partnered with Amazon, I was able to, you know, go in and check out what a day in the life was like for the implementers. But while I was there, also the Amazon logistics folks were there. And so it was really cool to see them collaborate with the warehouse workers on how to optimize space and use the equipment to move like large pallets, and also their routing software. I had heard from the delivery drivers like how cool that was to plan their routes and save time and really navigate rural challenges. So I thought that was really neat.
There are actually some really good questions that have come in while we were answering, so which is great. I'll read off the first one here from Lacrinthia Watts. This program represented a robust operational model. What key insights or considerations would you recommend for a state looking to implement it? I'm not sure which model you're referring to, Lacrinthia. Maybe you can put it in the chat so we can provide you with a more accurate response. We can always come back to this question after Lacrinthia has a chance to answer. Joe, we can move on to another question and come back.
Yeah, I'm reading the other one right above it as well, that also looks at non-privately funded rural programs, and in thinking about recommendations for a state. So I'm kind of thinking that there might be something there. I think with us, you know, these interventions were privately funded. We did try to explore some rural non-congregate summer food service program funding, but we're unsuccessful. So we know that that is a challenge and something that's worth exploring. I don't know, Esther, if you want to add anything to that. And I know in that instance, we did involve the state in which we worked in. So I don't know, Esther, if you have anything to add related to that.
Yeah, I can share a little bit about why we weren't successful in becoming a part of the SFSP program. So when the state team approached I think it was the Department of Education, to explore this option, they were told that the environment was already saturated with SFSP sponsors, and were giving some preference to other types of organizations to run these rural non-congregate SFSP programs. So that is a route that we tried, and we had hoped for SFSP funding to be a sustainable funding source for us to run this program, but we weren't successful. We talked a little bit about this in the report that Jillian mentioned. So I would recommend that you can read up and see what other advice you can glean from there to do it right.
Yeah, and I can put that link in the chat, right? I'm able to do that. So yeah, we have a section in the back related to sustainability and our efforts around doing that and what we learned specifically in that experience.
Samantha Dennison has a question. Do you have templates for mapping out considerations like trusted messengers and infrastructure, etc., to work partners through? I'm thinking about CI tool, Jillian. Do you want me to talk about it, or would you like to?
You probably know it more than I do, so you should talk about it for sure.
Okay. So Save the Children supports various communities around in rural communities to establish community coalitions that bring stakeholders to the table and to talk about what the priority issues are and to develop strategies to address these issues. And so there's a tool that is basically a stakeholder mapping tool. It's kind of like a matrix that helps teams to think through who needs to be at the table, what contributions they can bring, list out all the individuals' names, contact information, and this can be used as a conversation starter when they go into the community to speak with these potential partners. So I don't have that handy, but Samantha, if you can reach out to me by email, I think it's something I can share with you.
Great. I'm just checking the chat as well as the Q&A, see if there's anything else. I can also add in the chat the mobile unit report as well, if people are curious about that. There's a lot of implementation. Both of these reports are really centered around implementation. And so in the back of the report, you'll see much more robust lessons learned, implications, recommendations related to this work.
Okay, so Lacynthia has added to the chat a clarification for a question. It involves a lot of moving parts. What tips or advice would you help ensure smooth adoption and success? Okay, from a perspective of a state looking to implement these models. I'll start by sharing that I think two things come to mind. One is communication between the implementers. So with the rural home delivery that Amazon funded, there was a bi-weekly sync. And so having a standing call for the partners to share updates, an opportunity to ask questions, an opportunity to say, this wasn't working so well, how can we do it better? That standing meeting, I think, provides an open time for partners to just be at the table already. And then also, what we've seen lead to success is partners recognizing that there might be challenges or tensions that do come up and working through them. It's always a bit of a push and pull as they work through the challenges, but the end result is a plan that everyone has had input into, and a plan that everyone has had a chance to work through. And so, especially with adopting and implementing something new, challenges are going to be there. So not to be afraid of them, and to be committed to a solution. Jillian, what about you?
I thought that was well said. I think the sync meetings, when I think about that rural home delivery project and how when things were really ramping up, we increased from bi-weekly to weekly to make sure that all partners were working in lockstep and could raise, different things that might come up. If they couldn't find an address, because the area was so rural, they would go back to the school district and say, hey, can you see if you can find another way, or is this the right address, so just really working closely together and meeting consistently to make sure that we're sort of managing all the moving parts, because things did come up.
One last thing I would add is to document meeting notes, action plans, processes, so that and make it available for everybody to see, so that those can be a consistent reference point. And when any changes are made to those documents, everyone's able to see them and to also understand how those changes were made and who made those decisions.
Yeah, and I'll just add one more thing, that the key role in all three also was the school district. So making sure that they can come to those sync meetings, making sure that they play. There's such a big role, because even if there are, food banks or outside funders or even us, the school districts really are community hubs, and they really know their families. And so they, making sure that they're able to come to meetings like sync meetings and things like that are really important to make space for them. Great. And if there's no other questions, I think we can wrap up. I think that there might be, Kellen, are you still with?
Yep.
Okay, cool.
Yeah, thank you to our speakers, and for that. I'm glad that we had some good questions come in. All right, so up next, you can choose one of 3 sessions. To join one of those sessions, just click on the agenda in the navigation bar that's on the left of your screen, and be sure to click the right arrow to scroll through all of the available sessions so that you know all of the options. All right, and that concludes our time together for this session. So thank you very much. Day.
Thank you.
Thank you.